Climate and Health Country Profiles are a joint collaboration between WHO and UNFCCC in partnership with leading experts and advocates around the world and sponsored by the Wellcome Trust. The country profiles came about following a large climate and health conference at the World Health Organization, where WHO Director General Margaret Chan and the head of the United Nations Framework Convention on Climate Change, Christiana Figueres, agreed that it would be extremely useful to create these profiles, our contribution to support countries both in defining their positions going into the climate negotiations in Paris, but also in the longer term to help them to plan to protect their populations from climate change. These country profiles provide a brief snapshot of the impacts of climate change on health for a given country, the most relevant and reliable scientific evidence, along with climate and health projections from the meteorological and health communities is presented to empower ministers of health and other decision makers to engage, advocate, and act to protect health, both at COP21 in Paris and in the future.
The main connections between climate change and health are that many of the most serious health problems that we face today are highly sensitive to climate conditions. So diseases such as malaria, diarrhea, malnutrition, which kill millions of people every year. And we're also seeing more severe heat waves and more frequent floods and droughts. Climate change is likely to make those worse and is likely to increase the health impacts of those conditions. The other set of connections that we have is that many of the same processes that are driving climate change also cause immediate health problems. The energy choices that we make or the transport choices that we make both contribute to climate change but also contribute to air pollution, which kills over 7 million people every year around the world.
Climate and health country profiles provide up-to-date, accurate, timely information on the implications for health of climate change. We have come to this project together after discussions between climate experts and health experts, where we really felt the need to bring our two communities together, talk more to produce information that was relevant for health. Through these discussions, we decided that really we ought to select a small number of key indicators based on very solid climate information, but that are really more informative than the information that existed up to now. So our climate and health country profiles provide information of what the future health or future risks for health will be in a high climate change world and what these will be in a low climate change world, so that people really realize what are the implications of the choices that are made now for us in the future and for also future generations.
The information that goes into the country profiles is the most up-to-date information that WHO and the meteorological community, working with countries and their own data sources, have on climate projections and risks. The climate observations are taken from surface temperature measurements from the University of East Anglia, and data for climate extremes calculated using World Meteorological Organization guidelines. Climate projections are calculated from IPCC models. The data presented includes information and projections about heat waves, drought, and flood risk. The profiles look at country-specific data on the potential impact on health of climate change. This includes infectious diseases, heat-related mortality, and the risks to health from air pollution.
Addressing climate change could have health co-benefits. Reducing the emissions of carbon not only addresses and tackles climate change, but it also reduces air pollution.
And so we describe the country context and also describe some of the policies that they could put into place and the opportunities they have to improve health as they address climate change.
The climate and health country profiles can be used not only at COP to broaden the discussion, but in the future, to keep track of the implications for climate change and health policy, research, and investment.
The Wellcome Trust, as a health organisation, an organisation which is about research and science, has seen the relationship between environment and health as one of its key priorities. And what we want to do with this is provide really strong, evidence-based research background to countries about that relationship between what is going on in terms of that country, its climate and its links to health.
It's critically important as we go into COP21 that country policymakers and climate negotiators realise that climate change is a health issue. It's important that they have both recent and relevant evidence on the risks that climate change presents to health in their own contexts. And finally, it's critically important that they understand that by addressing climate change, they can have substantive, positive effects in their own countries and in their own communities.